morning. July 20th is World Hepatitis Day. Hepatitis means actually inflammation of the liver which causes jaundice. There are many causes for hepatitis like alcoholic hepatitis, toxic hepatitis, drug-induced hepatitis, and also virus. Hepatitis is caused by many viruses, and hepatitis caused by virus is known as viral hepatitis. Viral hepatitis is caused by many viruses, out of which important are hepatitis A virus, hepatitis B virus, C virus, Delta virus, and E virus. 5 types of virus, out of which hepatitis B is dangerous, very well known, and most common in the world. For hepatitis B, there's a vaccine is available to prevention. More than 400 millions of people in all over the world are infected with hepatitis B virus. The prevalence is least in America. India has about roughly 440 million hepatitis B virus infected persons. China, they have 120 millions of people infected with this virus. In Africa, it is most common. It almost prevalence is more than 20%. These infected persons are prone to develop complications like liver complications, like cirrhosis liver and hepatocellular carcinoma. 60,000 of people annually die of hepatitis B. So prevention of hepatitis B is very, very important for almost all countries in the world, especially underdeveloped countries like Africa and Asia. About this virus, the hepatitis B virus, actually Dr. Bloomberg from Australia discovered hepatitis B surface antigen in 1966, for which he was awarded Nobel Prize in 1976. And other scientists like McClellan discovered the virus, and in 1970 Dr. D.S. Dane has showed the virus in the electron microscope. That's why now the hepatitis B virus originally was called also Dane particles. About the virus, it's a DNA virus, 42 nanometers. It infects and replicates inside the liver cell, hepatocytes, inside the liver cell, but also it is present in the blood. Sometimes it integrates, that means combines with the liver cell nucleus and permanently resides there. That is the reason why we cannot able to eradicate the hepatitis B virus from the body once they are infected. In hepatitis B infected patients, we can find out various particles related to the virus, like 42 nanometer particles of the complete virus, 22 nanometers of the coat of the virus, that is known as hepatitis B surface antigen, what everybody knows, 27 nanometers core particles, hepatitis B E antigen, and DNA polymerase. Hepatitis B, there are 4 serotypes and 8 genotypes. Genotypes important because the type of the disease severity depends upon the genotype. In India, genotype D is common. Genotypes are available, are labeled as from A to H, like 8 genotypes. What exactly the pathology, how the virus infects the liver? The virus first affects the liver cells, hepatocyte, and enters the liver lymphocytes and starts multiplying. That is known as replication. The replication method is reverse transcriptase replication. The virus does not directly kill or destroy the liver cell. The virus enters the liver cell and started replicating, and with that there is a change in immunological mediated T lymphocytes are stimulated. They destroyed the infected liver cells, hepatocytes. That is the reason why the liver gets affected, because of destruction of liver cells and also infiltration of inflammatory cells. That is known as inflammation of the liver. Why? Well, how it is transmitted hepatitis B? Hepatitis B in infected persons usually is in the blood and body fluids like saliva, tears and semen, ascitic fluid, etc. It is transmitted mainly by contact with the blood and blood products. That is known as parenteral transmission. How the parenteral transmission? Suppose infected person's blood is given by blood transmission to normal person, he gets the infection. That is by blood transfusion, needle stick injury, a needle which was stick to the infected person and same needle was infected, that is needle stick injury to the other person, gets the hepatitis B infection. Contact with the blood and blood products, for example, healthcare workers, and constant, continuous, close contact in old age homes, handicapped homes, physically handicapped homes. So that is a parental transmission, either blood transfusion, needle stick injury, or exposure to blood and blood products. Second method is by sexual transmission. Infected person can infect the partner, either female or male, by sexual transmission. Third is from infected mother to the child. This is known as vertical transmission, which occurs from infected mother to the child during the delivery. These are the major three methods. Apart from the major three, it was found some cases, we don't know how, absence of this, they get the infection, some unknown route or some prolonged close contact. Here one thing you should know is, hepatitis B is not transmitted by sharing the same towel, utensils, household things, sleeping together, staying together, or kissing, or hugging together, or in the schools or in the college. It's not transmitted with the contact. That means it is not a contagious disease like a smallpox, etc., etc. What is the clinical features? Clinical features, usually the incubation period is 30 days to 180 days, usually average 4 weeks after contacting the infection. After the incubation period, the patient gets the constitutional symptoms. That means the patient will have fever, headache, body pains, myalgia, weakness, anorexia, nausea, vomiting. These are the prodromal symptoms. Usually patient thinks I got a viral fever. After 3-4 days of the constitutional symptom, the fever slightly subsides, then the jaundice appears. The patient knows first discoloration and high color of urine, then it is seen in the eyes, conjunctiva. That's how patient or the doctors come to know the patient developed a jaundice. And this jaundice usually lasts for 1 month to 4 months, sometimes 6 months, depending upon the severity of the infection. And afterwards, the jaundice gradually subsides, patient fully recovers. 95 to 99% of patients who develop infection with hepatitis B, they recover completely and becomes totally normal, including the liver and the liver function test. Some patients develop constitutional symptoms like fever, headache, body pains, etc., but they don't develop jaundice. This is known as anicteric hepatitis. That means without jaundice, they develop hepatitis. When you check the LFT only, you know the patient had hepatitis. Some patients, most of the patients, 95 to 99, they recover completely, but some patients patient developed a severe jaundice. That means the serum bilirubin is more than 20 to 30 milligrams, and the patient will have continued the symptoms of anorexia, nausea, vomitings, prolonged prothrombin time, low serum albumin, and hypoglycemia. These patients are known as severe hepatitis. They also usually recover from the illness, but they take little longer time, like 3 to 4 months or 5 months, and they recover. What are the complications of hepatitis B? Most of the cases, as I told you, they recover, but some cases they develop complications. Sometimes serious complications, sometimes chronic complications. Usually there are 4 types of major complications they develop because of hepatitis B infection. Some patients, very few, 1 in 100, develop acute liver failure. That means the liver is completely damaged. Patient develop jaundice, and usually they develop drowsiness and go into coma, develop multi-organ dysfunction, cerebral edema, and they die. In this patient, that means entire liver is destroyed. That is known as acute liver cell failure. The mortality is, if some patients getting this disease, almost more than 80% they will die, in spite of excellent treatment. Second complication is chronic hepatitis. Chronic hepatitis is one of the serious complications. Actually, nowadays, a lot of research has been done on chronic hepatitis because these patients, untreated, they go for cirrhosis, gradual cirrhosis liver, and also later on hepatocellular carcinoma. Almost out of 100 cases, almost 3%, 3 cases, they develop chronic hepatitis. Other serious complications, hepatitis B chronic infections, are cirrhosis liver. Cirrhosis liver means the entire liver is become shrunken, fibrosed. Only 20 to 30% normal cell liver remains. These patients will have chronic problems like, once this is irreversible disease. Once the patient develops cirrhosis liver, the liver never becomes normal. Then whole of the life they'll have complications like jaundice, hematemesis and melena, ascites, hepatic encephalopathy, and extreme weakness. These patients usually, once they get survived, they don't survive more than 2 to 5 years, depending upon the severity. The last complication is hepatitis B, and also including hepatitis C, is because of chronic infection. These patients, after 20 years, virus in their body, which is permanently remaining, they develop liver cancer. That is known as hepatocellular carcinoma. So these are the things, because that's why prevention of hepatitis B virus infection is very important in this world. How do you diagnose this hepatitis B infections? Very simple. Patients comes with constitutional symptoms, jaundice. Doctor will do all the investigations specifically for liver function test, where the liver enzymes are raised to 100 or sometimes thousands. Normally it is 40, SGOT, SGPT. Sometimes they are elevated up to 1000, 2000 or 4000. And also viral markers of hepatitis B, like hepatitis HBsAg, anti-HBC, DNA polymerase, hepatitis HBeAg. With these viral markers, doctors can confirm the diagnosis of viral hepatitis because of hepatitis B infection. Apart from that, they can do routine investigation of hemogram, biochemistry, ultrasound abdomen, and other routine investigation which are required for it. Treatment, most of the cases they recover spontaneously. In the mild case of jaundice, usually they don't require hospitalization except they have severe constitutional symptoms, continuous vomitings, very deep jaundice. Otherwise, most of the cases can be managed in their house. Treatment is mainly symptomatic, that is rest, good nutrition. Antiviral therapy is no use for acute infections, acute viral hepatitis. Chronic hepatitis, yes. Now important is, there are about 400 million of people in the world who are infected with hepatitis B virus. They are potential source or reservoir. They transmit the disease to others. So question is, prevention is most important. Otherwise, these reservoir of 400 million keep on increasing. All over the world, they are taking all the measures for prevention of hepatitis B infection. Now, as you know, we are all using disposable syringes. During blood transfusion, all the laboratories are mandatory to check for the HIV, HBS, hepatitis C and hepatitis B. So now almost all countries, the blood transfusion associated with hepatitis B infection is eliminated. And also needle stick associated infection is eliminated because we are using disposable syringe. Earlier, one syringe used to be used for number of patients. Second, also, we are detecting the case of mothers with hepatitis B infection, and during the child, immediately after birth, we are vaccinating the child with hepatitis B immunoglobulin and vaccine. So these are some of the prevention measures they have taken. Some of the world, many countries, they started universal vaccination. That means entire population, especially all newborn babies must. That means next generation people who are coming in the world, they'll be vaccinated and coming out, so they will never get hepatitis B infection.